Hello po, everyone. Parang nawala ata yung cover natin. Would you like to show the cover first about the COVID variants? Ayan. So that's our topic today. Bakit po may mga COVID variants? Bakit nga ba? So today is a holiday. It's the holiday po of the Immaculate Conception. I'm Dr. Ana York Bondoc. And kahit late na po, we'll just do a few short Q&As to take advantage din po of everybody's time. So please follow us on YouTube and Facebook Live. Meron din po kaming TikTok. And hopefully we can answer a few questions regarding COVID. And we also do accept questions about non-COVID topics. Ilagay lang po sa baba. Sasagutin po namin and we'll pick up your concerns for today. So let's start po. Bakit nga ba may COVID variant? You know, I decided to pick up this topic. Please put the question, bakit nawala? The question that I often get is, and what I hear from people is, Doktora, ibang sakit, question mark naman, there's a question. Opo. Ibang sakit po ba ang Omicron? Question mark. So, I also got that po from people na ibang sakit po ba ang Delta? Ibang sakit po ba ang Omicron? Okay? So, what do they mean? Iba from where, no? Is it different from COVID? That is actually the question that I often get. So, ililinaw ko lang po, no? Lahat ng variants na yan, they are only one disease. Isang sakit lang po, no? And this sakit po is what we call COVID-19. It is caused po by the COVID-19 virus. Ngayon, these variants, meron na, umabot na po, no? Before they used to be named after places, now they're named after numbers, Greek numbers, para hindi po magkasamaan ng loob. We had the alpha, the beta, the gamma, and then napunta tayo sa delta, which became the most serious and went around the world, and now we have the Omicron. These are the napakarami pong variants that were discovered, but these are the variants of interest which eventually became the variants of concern. So, ibang sakit po ba ang Omicron? Ibang sakit po ba ang Delta? No, that's only one sickness. Kaso, siguro let's go to the... So, isa lang po ang sakit, ha? Isa lang po ang sakit, and that sakit is COVID-19. Okay, next.
Letter B. Bakit may variants?
Yes, what are variants nga ba and how do they form? Variants are formed by mutations. Okay, pupuntahan rin natin yung mutation later, no? But basically po, as the COVID virus transfers from person to person, it needs to multiply po dun sa loob po ng katawan ng tao. What's the meaning of multiply? Kailangan manganak siya. Dumami po siya. It needs a host. That host is a person. A virus cannot live outside of the host. Para siya pong parasitic nabubuhay po siya within the body of the host, okay? That host po, yung mga taong may sakit. So, lumilipat po yung the virus from person to person sa hininga po ng tao, no? And then, malalanghap nyo po, then it enters your body. Once it enters your body, marami na rin ho, no? There's an amount of virus that enters. Kaya lang, kailangan po niyang manak at dumami sa loob po ng katawan ng tao. And paano siya po nanganganak? Wala pong male and female, ano? It reproduces itself, okay? The virus produces many parang anak po, no? Same, it self-reproduces, okay? Para dumami po yung mga virus sa loob po ng katawan ng tao. And as it reproduces, habang siya nanganganak, gumagawa po siya ng genetic code. There is a genetic DNA code. Ngayon, dahil po sa bilis po ng reproduction at sa dami po ng anak na nagagawa, sometimes the production of the genetic code is not exact. Nagkakamali po, no? There are changes and mutations within the genetic code of the virus. Okay. Sometimes, puntahan po natin si letter C. Letter C po. Letter C question. Ano yung mutation? No? Opo. So these are mutations, these are changes in the genetic code. Sa bilis po ng reproduction, nagkakamali-mali po once as they make the genetic code, and these form what we call our mutations. Okay? Sometimes the mutation, humihina po yung virus. sometimes the mutation, lumalakas po yung virus. And ito pong mutation na lumalakas po ang virus, the Delta was one such mutation. And the Omicron, marami nga pong mutation. So many changes in the genetic code. It remains to be COVID-19, but there are some subtle changes. And ito po yung mutations. Now, as it happened po sa Delta and sa Omicron, the mutations made the virus more nakakahawa and stronger. So, because it became stronger, parang yun po yung variant or yun po yung klase ng COVID na parang it took over, nangibabaw siya dun sa ibang dating variants ng COVID because mas malakas po siya at mas nakakahawa. So those are the mutations. Pag marami na pong mutations talaga, then they form a variant. And then pag if the variant mukhang dumadami po and it seems to be a strong variant, then it becomes a variant of interest or VOI. And later kung talagang kumakalat na po at nangingibabaw sa ibang variants, then it becomes a variant of concern. Actually, napakarami. There are thousands of variants. One of these was the Philippine variant. Pero hindi po meron pang lambda pero hindi po dumami ng dumami. Kumbaga, not all variants will become stronger. Not all variants will go around the world. Not all variants, merong iba po na, marami po silang parang mga anak. Hindi naman lahat ng anak sisikat. Okay, so yung naging sikat, yung nakakahawa, yung mapanganib, then these are the variants of concern and these became named Alpha, Beta, Gamma, Delta, and now Omicron. Okay? So mutations are changes in the genetic code of the virus that occur with rapid reproduction po. And if the mutation makes the virus stronger, it may eventually it makes the variant stronger, it may eventually take over, mangibabaw po siya, and become a variant of interest, and finally, a variant of concern. Okay, next question po.
Letter D. Paano maiwasan ang paglabas ng bagong variants?
That is a very good question. At bakit po lumabas yung Omicron sa Africa? The more po that the virus infects persons, in other words, mabilis kumalat. At mabilis kumalat dahil walang bakunado. Kasi once bakunado ka, you are protected. May level of protection ka. It is not 100%. Pero definitely, mas mabagal po ang kalat po ng virus in a vaccinated population versus an unvaccinated population. So, pag unvaccinated po, hindi bakunado, mabilis pong kumalat doon from person to person ang COVID at mabilis din po siyang manganak. Sa sobrang bilis po niyang manganak, then that's the time mutations occur. They will not occur or mabagal po ang occurrence of mutations in vaccinated groups of persons or vaccinated countries kasi po parang protektado na yung mga tao doon. So hindi po kakalat ng ganon. The more kumalat, the more manganak, the more manganak, the more mutation. Ganon. So, tinatanong ng mga tao, bakit, why did it come out in Africa? Because, sad to say and sorry to say, konti lang talaga bakunado sa Africa. So, marami pong mga victims and marami rin pong mutations that would occur. So, it is very important for us to be able to vaccinate the entire world. Kasi, kung meron halimbawa sa US and UK, maraming ang bakuna, kaya lang walang bakuna sa Africa, may darating na mutation, nangyari na nga, at yung mutation na yon sasakay rin ng eroplano kasama ng ibang tao, and they will eventually reach the first world countries. So tama po yung kasabihan na no one is safe until everyone is safe.
Letter E. How to protect ourselves from variants?
Pareho lang po, no? The advice has always been consistent from the beginning, which is, first of all, don't panic. Hindi naman lahat ng variant nagiging kasing bagsik o kasing nakakahawa ng Delta. We don't really know yet what's gonna happen to Omicron, though it seems to be spreading. Pero, may balita naman pong mild. So, don't panic. Marami pa pong mangyayari. Again, mask and social distancing is very, very, very important. Kasi kahit anong variant po yan, the mask will protect you. Okay? Kasi sa hininga po yan ng tao. And then after that, magpabakuna din po tayo. Though may balita na maraming mutations po that could possibly decrease the effectivity of the vaccine, hindi po magiging zero po yung effectivity niyan. Meron at meron pa rin po tayong protection makukuha po sa mga bakuna. So vaccinate and booster, that's really what we can do best. So again, how to protect yourself from kahit anong variant pa after Omicron, kung sakaling darating ang Omicron sa Pilipinas. And I do have a feeling that it's only a matter of time. So, umiwas lang po, no? Kung hindi naman tayo kailangan pumunta doon, don't do it. Number 2, if you have to go, wear a mask and socially distance. Sana bakunado kayo if you are vulnerable, senior, ganun po. Maybe even booster. So, yun lang po. Don't panic, but protect yourself from the variants. The newest variant, again, as I said, Omicron, okay? Or Omicron. Hindi po siya majority, most people do not say Omicron. So my advice to you is Omicron. Okay? So yan lang po. We're happy to take a few questions today.
From Ms. Jimmy Soriaga, good afternoon po, Doktora. Tanong ko lang po, paano po malaman kung meron pa po na antibody, nagka-COVID na po at kailangan ko na po sana magpa-booster shot. 2 months na po after nagka-COVID.
That's very good. Pwede na po kayong magpa-booster. I'm glad po, sir, that you recovered. You know, we don't test kung may antibody because hindi na po, we do not do antibody testing to check po kung may antibody or wala. We just automatically boost, especially po kung 6 months na po and if you are a senior. There's no need to test your antibody. And again, pwede hong zero yung antibody nyo, pero meron naman pong memory cells that the memory cells can produce antibodies in 5 minutes pag may nakita pong COVID, okay? So the antibody test, number 1, we do not know kung ano yung absolute number na antibody that can protect us. Number 2, kahit wala na kayong antibody na makita sa test, meron pa pong memory cells which are not measured, and those memory cells, may memory nga, can produce an antibody in just 5 minutes and marami na rin ho kayong antibody pag na-COVID.
Okay, from Ms. Christine Alinsugay, Abraham. Doc, pwede po bang magpa-COVID vaccine kahit may ubo at kaka-recover lang from flu 2 weeks ago?
Ma'am Christina, thank you, and I'm glad that you recovered from the flu. Ma'am, kung may ubo pa po kayo, hindi po kayo makakapunta doon sa vaccine site eh. Kasi one of the questions that they will ask kung kayo po ay may nauubo or inuubo. So my best advice to you is have a checkup po bakit hindi pa po nawawala yung ubo. One of the frequent reasons is irritation po ng airways, and sometimes the doctor would like to prescribe po inhaled steroids. But before you do that, check up muna. Okay? And once the doctor says okay at wala na po kayong ubo, bakuna na po.
From Ms. Josephine Malco Salonga. Good afternoon po, Doktora. Itatanong ko lang po kung talaga po bang naglalagnat ng isang bata na nagkaroon ng pneumonia. At ngayon po ay meron din po siyang pulmonary tuberculosis.
Ay, wait. Excuse me, stop. Bata po ba ito?
Yes po, Doc.
Ma'am, I'm not a pediatrician. I'm sorry. I'm really sorry. Again, please don't pick up questions about kids and just type po, sorry, hindi po talaga pedia si doktora. And at least aminado po ako that I am not qualified to give advice about children. Ito lang po ang alam ko about kids. I'm a breastfeeding expert. Having been worked with some of the best breastfeeding advocates po sa Pilipinas, having breastfed a baby from 0 to 5 years, having had personal difficulties, hanggang dun lang ako may lakas loob sumagot. Wala po akong lakas na sumagot tungkol sa mga pulmonya ng mga bata. My apologies po talaga.
From Miss Ligaya, Doc, bakit po pag 2 a.m. ng madaling araw, nauubo po ako? Ano kaya ang dahilan?
Wow, very interesting question, ma'am, okay? Two disease entities come to mind, or maybe even 3, okay? Possibility number 1 is asthma. Why am I saying this? If you are sleeping po in a cold room, at lalo na po Disyembre ngayon, there is cold triggering asthma. So, try to investigate po yung yung kwarto nyo. Malamig po ba? And is it triggering your asthma? And asthma po can manifest as cough. So, investigation po nun. Number 2 possibility is GERD, gastroesophageal reflux disease. Sometimes po, pag humihiga po kayo, it's 2 o'clock in the morning, bumabalik po yung acido. People feel acidic, sometimes people cough, dumidighay, ganun po, no? If you do think it's acid, have a check-up. Again, bawasan po yung kinakain just before you sleep, 3 hours, don't eat and elevate your head. At third possibility po is congestive heart failure. As you lie down po, no, if you are having heart failure po o problema po sa puso, pa-check up nyo lang, hindi ko sinabing yun ang sagot. People sometimes wake up gasping for breath and that may include coughing. Okay? So patingin nyo po. And number 4, you might be suffering allergies in your room. Ano ba, yung kumot nyo, are you sleeping with a dog? Is your husband is your husband smoking? Ganun po, no? Try to investigate rin po yung sitwasyon po ng kwarto nila. Okay? So, all of that is a possibility. Meron pong mga mild, meron pong medyo slightly serious, but the most important po, pa-check po kayo sa doktor. And if this is happening all the time. Okay? I would say po, the most benign, paimbestigan nyo muna, is if your room is too cold. And number 2 po, if there is anything na nakaka-allergy doon. The CHF and GERD are more serious problems and you can eliminate po muna yung mas simple. Okay?
From Miss Glenda, gandang hapon po, Doktora. Nabasa ko po yung post na libre konsulta. Nais ko pong magtanong about sa matagal ng pag-ubo. Nakapagpa-check up na rin po ako at binigyan ako ng antibiotic ng 1 week. After noon, di na naulit ang ubo. Madalas madaling araw yung pag-ubo ko. Kaya halos napupuyat ako. Bumalik po ulit ako sa doktor. Another gamot sa allergy naman ang binigay at meron pang isang klase ng gamot. Nawala naman po pag-ubo, madalas, lalo pag madaling araw, bahagya na lang. Pero bakit ganun po kaya? Natatakot po ako. I think that's...
Ma'am, I think I answered that question earlier. There are 4 possibilities. Nabanggit na po, you're being treated for allergies. Possibly asthma. No? So, try to investigate po if you are asthmatic. Number 3, acid reflux. Nakakaabo rin po yun. And the 4th is congestive heart failure. So, paimbestigan nyo po sa doktor nyo po yung 4 possibilities po na yon. But sometimes, ayoko pong pumunta sa pinakamalalim, doon po na muna tayo sa pinakamadali, which is changing the environment po in your room. Maybe investigating if you're allergic to dogs, or do you sleep with your dogs, cats, pets, cigarette smoke, linisin po yung buong kama, at saka po, grabe rin po ng vacuum everything, your room could be dusty. Okay? Ngayon, kung lahat po yung ginawa nyo na, and hinihingal na po kayo and you're starting to have a problem, chest pain, you're waking up po, gasping for breath, well, that requires more serious investigation po. Okay? And the 4th issue, meron din pong medication, so please also review your medications with your doctors kasi may mga gamot po na usually for high blood na nakakaubo. Okay? So, investigation po doon.
From Ms. Dr. G.M. Regala, Doktora Ana, itatanong ko lang po kung pwedeng magpaturok ang isang tao na may sakit po na low potassium.
Actually, low potassium is not a disease. Low potassium is, why do you have low potassium? Pero again, no, if you want to have a COVID vaccine, wala naman pong, there is no prohibition against potassium. But I guess what you need to find out from your doctor, sir, is ba't mababa yung potassium nyo? Kasi usually that has something to do with medication or your kidneys. So, alamin nyo po muna. But kung gusto nyo, halimbawa, tinawag na po kayo ng LGU nyo tomorrow, you can have a COVID vaccine. Wala naman pong prohibition po ang potassium. Okay?
From Mr.
Wait lang mild low potassium. Kung sobrang low potassium, kailangan na pumunta sa doktor and emergency room kung talagang like 2 na ho yan, okay? So, yun lang po.
From Ms. Teresa, good PM, Doc. Ano po ang mabisang gamot pag laging sumasakit ang likod?
First of all, Ma'am Teresa, first of all, we need to know why is your back painful. Ako po, I'm not a believer in diretsong gamot, and we have to find out what is the problem. So my suggestion po is imbestigahin po muna sa inyong doktor why you're having back pain. You may try a few over-the-counter painkillers, pero kung hindi po talaga umaalis or nawawala, then or talaga nagtatagal na ho kayo and you're starting to take a lot of painkillers, investigation po yan ng likod. Okay?
From Miss Rosalie Abayon Serrano. Dok, magandang umaga po. Pwede po ba akong magtanong patungkol po sa nanay ko? Ang payat po at may asthma. Ano po ba ang dapat inumin po niya? 76 years old na po siya.
Well, first of all, thanks for asking this question about nanay. Payat po at may asthma. Ang hirap pong what do you want me to deal with first? The payat or the asthma or both? There's a lot of things to investigate eh. First of all, what is the diet of your mother? Ano ho ba kinakain ni mommy? Maybe you can spend time cooking her regular foods at yung mga gusto po niya. People who are older may sometimes not eat because they have bad teeth, or yung mga matatanda po talaga, yung dentures masakit. So investigate that also. And then, thirdly, bakit siya payat? Of course, we have to investigate po, gaano ho kapayat? Like, you have to investigate po, bakit siya payat? Could it be diabetes? Namamayat po ang diabetics? Cancer, that's also a case. Are you sure it's asthma? Kasi TB po, namamayat din. And then, there are a lot of diseases po that cause kapayatan. Thyroid is another one, ano? Kung talagang na-investigate naman ho yan, that's all normal, then just encourage po yung mother niyo to eat. What vitamins? One multivitamin is good for mommy. If she doesn't really like to eat, there are yung mga meals po na mga Ensure, ganon, she can take one of them, meal replacements. Okay? At saka po, kung minsan, ito lang sometimes, sometimes sinatakot po natin yung matanda sobre, like bawal yan, high blood yan, tuloy lahat na bawal na. Everything po in moderation is my suggestion. With regards naman po dun sa asthma, patingin nyo rin po, no, there are medications for asthma, which include po yung inhalers, beta-2 agonists, yun ang mga Ventolin po, mga Seretide, ganun po, no? And then there are inhaled steroids. These are good combinations po for an elderly person. Okay? So, I don't know, ang hirap po eh. There's a workup po talaga for kapayatan. There is a workup. And I mentioned a few of those po. The most important, i-clear nyo lang ho na walang ibang sakit po. Like diabetes, nabanggit ko na po, no? And other diseases, i-check po yun ng doktor. And kung ma-clear naman po si mommy, then siguro let's spoil mommy a little kung ano po yung gusto niyang kainin, pagbigyan natin, okay? And again, I would like to ask you, bakunado na po ba si mommy? It is very important for someone who is 76 years old and asthmatic to be fully vaccinated po. That is 2 shots of any vaccine, whether it be Sinovac, Astra, Pfizer, or Moderna, and 1 shot po ng Johnson & Johnson. And pag na-achieve na po natin yon, if we want to move forward towards another shot pa po na booster, pwede naman po. Pero the most important, tapusin lang po natin yung 2 shots po ng bakuna. Okay?
For Miss Ariel, Subsilicus tamarina. Doc, ligtas po ba ang may asthma na magpabakuna? Ano ang side effect nito? Thank you.
The most common, yes, people who are asthmatic can be vaccinated and should be vaccinated, okay? Kung may doubts po kayo, you may get a clearance from your asthma doctor. Most common side effect po ng bakuna talaga yung pabibigat ng kamay, okay? Talagang bibigat po ang inyong kamay. Some people po may develop chills for over 24 hours. Kung tumagal pa po, then it's time to see a doctor. Pero milyon na po ang mga Pilipinong bakunado. Most of them, 99.999% remain to be alive. Okay? So kaya po nyo yun. You can do it. Ito lang ang tip. Kung natatakot kayo sa side effects, go for Sinovac. Ang Sinovac po, ang pinaka-least side effects. What is least? Pinaka-mababa po, pinaka-konting side effects ang Sinovac.
Another question from Mr. Charlie Vinuya. Doc, ano po bang magandang gamot sa TB?
Sir Charlie, it's not yung magandang gamot eh. Talagang ako, I'm more worried about TB than COVID eh. We test po the sensitivity and specificity, no? We test, kaya po dumudura po tayo. Okay? We have to dumudura po tayo into a lalagyan, and then they grow it, and then they test po the gamots for TB onto yung dura sample nyo po, no? Why do we do that? Kasi po marami na pong klase ng TB na hindi na po tinatabla ng gamot, or what we call drug-resistant TB. So, based po dun sa studies na gagawin po dun sa dinuranyo na may TB bacilli, yun po ang kailangan yung inumin na gamot. So, I would not say kung ano yung magandang gamot sa TB, pero kung ano po yung gamot sa TB na pinapatay po yung TB ninyo, or what is your TB sensitive to. Okay? Hindi po natin choice yun eh. That will come out po in the laboratory.
From Ms. Virglen Ortiz. Good day po. Pwede po bang magpa-vaccine ng pang-COVID yung na-inject ng anti-tetano? Thanks po.
Yes, you can be vaccinated po for COVID if you've had an anti-tetanus vaccine. Ang advice ko lang po is wait for 2 weeks. Kung totally okay na kayo, then have yourself vaccinated for COVID. Okay?
Okay po. Next po.
Wait Ma'am Reyna. I would advise a 2-week wait between tetanus and COVID para lang ho hindi maghalo yung whatever happened. Kumbaga, tapos na si tetanus, and then let's wait for 2 weeks, and then dun tayo magpa-COVID. Okay? It's lang para hindi maghalo po yung dalawang insidente.
From Ms. Eda Libratilla, Doktora, good evening po. Sumasakit po lagi ang left side na gilid ng near ribs ko po. Bakit po kaya ganun? Salamat po.
Ma'am, how old are you? What do you mean left side? Left-sided chest pain? Left-sided chest pain po should always be investigated po, especially if you are male, a smoker, diabetic, and old, and it occurs with exertion. So, I don't know po yung age nyo, but if females over the age of 50 na postmenopausal po should also be investigated po for cardiac disease. Any form of left-sided chest pain, no? Should be investigated po for cardiac disease, especially for anyone over the age of 50. Hindi ko po alam. I cannot answer the rest of the issues po. 67, ma'am. Okay. Ma'am, kung is it on the left side dito po, no? Investigate and see your doctor po. Lalo po kung kayo po ay hinihingal and this occurs with exertion. After that po, pag na-clear po yung puso nyo, we can take our time to investigate. The most important po is to clear your heart. Okay? At wait, don't panic, mama, just because you heard the word heart. It's just to be sure. All right? Better naman po na maimbestiga, imbis na hindi po maimbestiga. Okay?
From Ms.
Kasi,
Rosie,
pag puso po, we need to work on it immediately. Kung hindi naman po puso, then we can take our time. That's something very important that people in medicine try to teach doctors. There is the immediate and urgent problem, and then there is the can take your time, no? One of the things they teach you in med school is to know when something is urgent and to know when something is not. Pag na-clear na po yung puso nyo, naku, kahit 3 months, pwede nating take time to investigate po. Okay?
from Ms.
And
Rosie,
again, kung hindi po nawawala, get yourself investigated.
from Ms. Roslyn Anisete, good evening po. Ask ko lang po, Doc, about sa friend ko na hindi makalunok or laging nabubulunan. Nagpa-check up na po siya paulit-ulit and findings acid lang daw po. Ano po kaya yung sakit niya? Sobrang payat na po kasi niya.
Uh-oh. Is she losing a lot of weight? Ma'am, pa-investigate. If someone is having difficulty swallowing and is losing a lot of weight, please seriously investigate po this for esophageal problems. Okay? Esophagus. Lalo na po kung sobrang namamayat. Again, we talked about kapayatan po, no? I don't want to scare anyone, but if someone loses a lot of weight po, cancer is always a consideration. So please check up po ng mabuting mabuti.
From Miss Rosemary Sonto, Doc, ano pong symptoms ng pulmonary tuberculosis? Bakit po kaya ako hinihingal pag nabubusog at nagbubuhat ng mabigat? Hindi po ba masama everyday mag-take ng Nebule?
Parang ang dami niyo pong hinalong this is our last question. Ang dami pong hinalong tanong eh. What are the symptoms? Let's go. Para I cannot understand this. Ang daming issue. What are the symptoms of PTB? Number 1, losing a lot of weight. Number 2, classic dumudura ng dugo. Number 3 po, once you look at the x-ray, talaga hong either may namumuti, basta the x-ray is not normal. Those are the classic signs of pulmonary TB. And number 4, ubo ng ubo. So kung yung kapitbahay nyo po ay ubo ng ubo, dumudura po ng konting dugo, losing a lot of weight, and you heard hindi po normal yung chest x-ray, PTB po yon. Bago po ng COVID, that was the classic sign of pulmonary tuberculosis. Okay, what's the second question of ma'am?
Ang second question po is, bakit po kaya ako hinihingal pag nabubusog at nagbubuhat ng mabigat?
Ma'am, again, shortness of breath. Two main issues, the heart or the lungs. Pa-check nyo po yon. Kung lalo na po pag on exertion at nagbubuhat, then usually it's coming from a cardiac cause and you need to investigate po yung puso. Okay, next.
Next issue po is, hindi po ba masama everyday mag-take ng Nebule?
Ma'am, Nebule ng ano? Well, the most common nebules po, no, ito are most of the nebulized gamot po is for asthma. Okay? Most of the nebulized gamots po is for asthma. And we actually prescribe Ventolin nebules po 3 times a day. So, if it is Ventolin po, you may take it 3 times a day. Kaya lang po, if you have asthma, hindi ko po alam kung anong sakit nyo eh. I'm just presuming po that the most common nebulization po talaga na ginagamit ng mga tao is Ventolin. For asthmatics, chronic obstructive pulmonary diseases po, no? We can nebulize with Ventolin or salbutamol po, no, up to 3 times a day. Pero kung talagang dumadami na po yung paggamit nyo ng Ventolin, well, then it's time po to discuss po with your doctor. Meron pong long-acting, but it is an inhaler. So I don't know if we're talking about asthmatic nebules po dito at pwede nyo pong iklaro sa akin. People have been known to nebulize with Ventolin for every day, twice a day, thrice a day. Pero sometimes, pag medyo madalas na po, no, and kung minsan nakakahirap pong lumabas ng bahay kasi you have to go back to nebulize. Tsaka pag very frequent po yung nebulization, that means the control is not good. I would discuss with your pulmonologist yung long-term inhalers po. And then kung hindi pa rin ho nako-control, I would consider po starting inhaled steroids. Okay? So sa inyo po lahat, I'd like to remind everyone that these questions po, no, I'm only answering them based on what you told me. The most important po talagang advice that I can give is to have a consult with your doctor, lalo na po kung nagtatagal po yung simptomas po na inyong nireklamo. Yung binibigay po natin ngayon is just an overview of the problem. Hindi po yun specific sa inyo. Wag ho kayong panic na meron po kayong problema sa puso. Hindi. I'm just sharing with you po the thought process that goes behind every symptom at bakit po nangyayari yon. So to everyone po, I hope you had a good December 8. Nanggaling po ako sa SM Pampanga. Diyos ko, ang daming bata. Maybe it's really time to go back to school because if the kids are just in the mall, then they should be in the school. Ikaw, Reyna, what do you think?
Well, darating naman talaga tayo sa panahon na maglalabasan na po ng sa ating mga bahay o mga lungga. So, mag-practice na. Yun.
So I think we're moving towards that. Yes, we
Yes.
are moving
Opo.
towards that.
Yes, but with a lot of
Kasi
precaution.
sabi nga nung isang teacher sa akin kahapon, bakit daw ayaw nila mag-school pero gusto nila mag-mall? Ay, ewan ko, hindi ko masagot yun. So to everyone, good December 8 and salamat po.